Hi, my name is Bree, and this is Tyler. Do I have your permission to record you for my therapeutic interventions 2 class?
Let's do it.
Awesome. So today we are going to be doing a core stabilization assessment and progression program. So first, I'm going to be looking at his posture. So just go ahead and face me, and I'm looking for any imbalances in his posture, so like rounded shoulders, forward head tilts, anything like that. So I'm just gonna take a look. So it actually does look like his left shoulder is a tad higher than his right shoulder, which is interesting because he is right hand dominant, but he did injure his right shoulder. So that could be why his left is higher. Everything else looks good from the anterior point of view. And then can you lift your shirt up for me really quickly? Oh yes. So face the camera. So he does have that pelvic tilt, the anterior pelvic tilt, so the lordosis. He does have that, and that can definitely affect his core for sure. And then just go ahead and relax now. And face the camera. Everything else looks pretty good other than that. And then next we're going to do the breathing mechanics. So we are going to see if he's breathing from his chest or from his diaphragm. So put one hand on your chest and then put another one like on your abdomen, and then just take normal breaths in and out, in and out. And then you are wanting to make sure that all your breathing is coming from your abdomen.
It is.
Okay, so that's good. So if you are primarily chest breathing, that can mean like you aren't fully engaging your diaphragm, which can impact core stability. So it's good that he is breathing from his abdomen. And then next we're going to be looking at movement patterns. So I'll just assess like basic movements to see how he engages his core. So let's do an overhead squat test. So you're just gonna put your hands straight up, and then you're just gonna squat down slowly. Then you can go ahead and go. So I'm looking for any excessive forward lean, knee valgus, or core lumbar control. So go on. Gotcha. So his knees do slightly go in when he's squatting. So I'll note that. And then next we can do a single leg balance test. So I can see if he can maintain stability or if there's like excessive hip drop or like any compensations. So stand on one leg for me and just balance as best as you can. So there is that pelvic hip drop. You can see his right hip is slightly dropped. Okay. So that could, and you can switch to the other leg. And he did mention to me earlier that he has tight hips. So that's another way to indicate that he actually does have tight hips. Okay. Perfect. Okay, that's good for that. So next we're going to do the drawing in remover. And you have to do the drawing in remover before you can do any of the core exercises. So, pretty much you do this to make sure like he's properly activating his deep core stabilizers. So what I'm going to do, would it be easier for your head to go this way? Yeah. It wouldn't? Okay, so lay your head that way. Okay, so I'm going to have him, so have your knees bent, like on this. Okay, yes. And then you want to put your hands right here, like right above your hip bones. Okay, and then the goal pretty much is you're trying to have your belly button touch your spine, if that makes sense. So you really, really want to engage those deep core muscles. So just go ahead and do that a few times. Do you feel it at all?
Yeah.
Perfect. Have you do that a few more times. Yes. Awesome. Yeah, so again, you just want to make sure you do this before every core exercise. Okay. That should be good. You can actually stay there because we're going to do something called the straight leg lowering test. So it pretty much just like assesses lower core control. So I'm going to have you, so like lay your legs straight out. Perfect. And then can you not rest your hands on your, or like you not resting by your side at all? Okay, I guess you can put it behind your head. This isn't really that wide, so. Okay, so you're going to like pretty much like do a leg raise, and I actually don't have a pressure cuff, so I can just like watch like visually, or I can palpate, or I can like put my hand under his back to see if it moves at all. So I'll actually do that. So, okay, so like just do a regular leg raise. Okay, and the goal is to try to keep like your pelvis all the way to the ground. Yes. Okay, that's good. So with that, I'm looking to see if his pelvic shifts at all, and it did. But it's very narrow, so that, I guess I'll give him some leeway on that. But the goal is to not shift your pelvis at all, and to really just like focus on those deep core muscles. So, so now, after doing that, so now we can transition to the core progression program. So since he has the pelvic tilt and like the shoulder imbalance, I can create a program to really help focus on those. So let's see. So for the first one, so for level 1, we want to focus on the core stabilization. So one really good exercise we can have him do is do the pelvic tilts on the ball. So this over here. So I'm going to have you sit on the ball. And I'll actually just demonstrate what you can do. So you just sit on it, and then you're just like rocking back and forth. But you're really like tightening your like, yeah, your core. Like pretty much like you're bracing for a punch. And you just rock back and forth. Yep. Yeah, make sure your feet are flat on the ground. Yep, there you go. And then just rock back and forth. Yeah. This really helps him like be aware of his pelvis when he's rocking back and forth. Can you feel it in your core at all?
I feel it, sure.
Okay, and then I would have him do this 3 sets of 10, and I would have him rest for like 30 seconds in between each set to give him enough time, so, especially since this is like level 1 workouts. And then the next one we can have him do is we can have him do the sit to stand with abdominal bracing. So you could do it on this again. So you're pretty much just gonna, okay, yeah. So you're gonna have your arms straight out like this, and then you're going to sit, and as you're sitting, you're again like bracing your core for that punch. And then going up, brace, and then deep breath, and then again. Like that. So I'll have you do that a few times. And then, again, I'll have him do this 3 sets of 10 with 30 seconds in between each set. Yep. Perfect. Okay, that's good. And next, we can have him do squats with a TheraBand to add resistance to it. So how do you put that around your legs for me? You can put it like right on the knee. Yep, so just really make sure you're focusing on good posture, good control. Yep. Yes, So you want to make sure he's obtaining upright posture and make sure that he avoids like overly leaning forward. Good. And since he does have that pelvic tilt, he does lean forward actually. So here, I'll show you. Go ahead. He leans forward. It's okay. It can be fixed. Okay. Now, after he does those and he gets comfortable doing those, we can move to level 2, which focuses on strength. So, this one, for the first one, we can have him do a bridge with single leg extension. So, do you want to move the mat over here? Do you can? Okay, just like lay on the ground. Okay, so since he does have that pelvic tilt, these will really help like build like the glute muscles, which will help fix the problem over time. So go ahead and lay down for me. So, which one was it? So the bridge with single leg extension. So again, the bridge, and then you're gonna put one leg up. Yep. Do you feel that in your core? Awesome. So I'll do that for like, yeah, 3 sets of 8 with 40 to 60 seconds in between each one for this one. Yep, okay, that was good. And then next we can have him do supine alternating arms and legs, so the dying bug. So, so that one is, wait, I don't think that's that one. Yes, that one, like you alternate, like the arms and legs. Yes. Yes. Yes, so that will really help engage those deep core muscles, for sure. Yep. Good. Yep. And then also again, just always try to make sure that your belly button is touching your spine as best as you can. Awesome. And then next we could have him do push up to the planks. So get in a push up position. And then you do push up and then like you come up, go to the side plank, yeah. And then I would have him do this 3 sets of 5 on each side, and then have him rest like 45 to 60 seconds in between. Perfect. Okay, that's great. And then after he masters that, we can move to power exercises. So we can grab a medicine ball. And then, so you don't have to throw it, but we're going to be doing overhead weighted ball throws. So these help develop explosive core strength and also helps you like with good posture too. So you're going to do this 3 sets, 6 reps. And this time I'll have them rest for 60 seconds to 90 seconds in between each one. So it's just like a squat. And then like when you explode up, you would throw the ball back, but you don't have to. Yeah, do you feel it in your core too? Okay, awesome. And then the next one we could do weighted ball, double arm rotation toss from squat. So you would go squat like that. Yep, and you would throw, and then you would switch sides. And that really helps work on the rotational. Yeah. Good. Okay. Awesome. So we would progress obviously from each one after he gets comfortable and he has good form and he's able to perform them without getting fatigued. And then for social determinants of health, so I would need to consider, you know, does he have a gym? Does he have access to transportation? Does he have insurance? Does he have a busy work schedule? If he does, I can integrate like things that will help him with time management, like exercises that aren't as like timely as they would usually be. What else can I do? Oh, also if he has past injuries, I can also incorporate modifications to help with that as well. For the ICF model, so the ICF model helps pretty much tracks how core weakness affects function. So, so my patient's pelvic tilt, posture, it also limits proper squatting and can increase injury risk in sports. So by following a proper workout plan, this can really help reduce all those. And then for my patient-reported outcome, I can use the functional movement screen, so the FMS, because I can help him track his progress over time. And then home care plan and self-monitoring. I can't say that word. So for home care, or for his like home workout, I would just ask that he stay consistent. And if he's like having any trouble or anything, he can always contact me. I also want to make sure that he's tracking his progress on his own, just so he can see how far he's gone or if he's gone back in progress at all. And also make sure that he's stretching non-stop, for sure, to help with those tight hips, help with the pelvic tilt, and all those good things. I think that's everything. Thank you.